How does research make it possible to build the evidence base to define the value of physical therapy? We asked 3 researchers supported through the foundation-funded CoStar, the Center on Health Services Training and Research. This is what they said.
My name is Jennifer Vincenzo. I'm a board-certified geriatric physical therapist.
My name is Jason Benechek. I was trained as a physical therapist.
My name is Mark Paterno, a physical therapist.
Everybody likes to claim that they provide superior outcomes, right? But the ability to actually use your data to support that statement, that's part of our big vision. First of all, collecting it, but then using it to inform clinical practice.
Much of what we claim could ultimately be seen as anecdotal. So having good data that would link best outcomes to a type of service model we can provide will ultimately support us whenever we approach policymakers or work with insurance companies to think about how we can best reimburse for what is best practice. For example, some health services work looking at alternative models of care can be not only identify practice areas that can be improved upon, but also think critically about how do we best implement that in our care setting.
With health policy, if we don't show that something works in clinical practice, policymakers aren't necessarily going to make it happen. And certainly another big issue is insurers. They work in dollars, they work in benefit. What's the benefit for them? Will that decrease their out-of-pocket costs?
My work for many years has looked at outcomes after ACL reconstruction. And actually some work done by one of my mentors actually identified that it was much more cost effective for those patients to receive booster visits, as there was less of a financial burden on the healthcare system in the long term. It's extremely challenging to get pilot data and to get much of this work going. So I think we're very fortunate to have the foundation to support work like this.
Numbers and data is what really speaks to policy people and insurers. So that is another huge reason that clinicians in any setting need to try and set up that data as much as possible.
The value of observational data, especially data that comes from your health system, is a great resource that we need to tap into.
The foundation is really critical, and I think providing financial support to really dive deeply into research to identify best practice, or if there are novel models of care, which we do think would provide a better outcome, developing strong pilot data that gives us an opportunity to go to larger funding agencies like the NIH. I think we're very fortunate to have the foundation to support work like this that will really hopefully accelerate some of these opportunities to identify and support new models of care, and also the value that they bring to the healthcare system.